A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with truechat.
State, county, and local leaders have put in measures in place to help reduce the number of people infected with COVID-19. Suddenly, in addition to having to deal with a pandemic, people are being asked to do things like educate their children, avoid physical contact with others, and sometimes even look for a new job. Change is a normal part of life. However, too much change can also cause anxiety or depression. Today, we have the opportunity to discuss that situation and strategies for overcoming them. Thank you for tuning in today. I'm your host for Mercy Moments, Terry Allen Ceyler, coming to you from Champaign County here at truechat Studios in Urbana, Ohio. I would like to welcome my guests today. Dr. Jonathan Lazera is a board-certified psychiatrist, has worked for several networks in the area, and is currently the clinical director of psychiatry for Mercy Health Urbana Hospital. Dr. Lazera, welcome.
Thank you. Really appreciate you being here.
Theresa Kahle is currently the senior behavioral health manager at Mercy Health Urbana Hospital. Before that, she was a psychiatric nurse for many years, and even at one point went to law school. Theresa, welcome.
Thank you very much.
So, Dr. Lazera, professionally speaking, is there anything that I left out?
No, I did spend 6 years in the Marine Corps, which kind of dovetailed into my medical career. But then again, that actually ties into additionally part of what I'd like to discuss today about the interactions of COVID and the causes on society and interactions of people from isolation, similar to deployment in the military.
Right, exactly. So, Theresa, tell me a little more about how you got involved in psychiatric care.
I stumbled into it. I was a nurse at 19 years old, and I wanted to work at this particular hospital. They were only hiring in psych.
Really?
Yes.
Nice.
And what I discovered is that I was meant to be in it, that I stumbled into it, but it was where I was supposed to be.
So what do you like most about psychiatric care?
That it is very spiritual. My parents were missionaries.
Interesting.
I'm a very spiritual person myself, and I do think that aspect is a very important part of balance and mental health.
Dr. Lazera, what do you like most about psychiatric care?
I always laugh because when I came out of the military, that is when I actually went back to medical school.
Uh-huh.
I swore there was two fields in medicine I'd never go into, and it was OB-GYN and psychiatry. And it really changed me was that I did a psych rotation and absolutely loved it. And then I started running into all these mental health issues from all my friends in the service. And it just became this love of a field that kind of enveloped me and took it from there. And I just kept expanding. And now here I am in psychiatry and couldn't imagine a day without it.
Dr. Lazera, what is your definition of mental health?
My definition of mental health falls into encompassing a myriad of different things. I think mental health is a broad term used in the hospital system, which is a legal term. Additionally, in the court system, it is a social term or a stigma put on by society. But if you just think of mental health as a combination of everything in the environment around you, encompassing your brain's reaction to things and how you respond to them, which creates a feeling that you carry with you and it becomes part of you.
I see.
And it can be interchanging throughout that.
So what are some of the most common ailments that you see today?
Right now, it's a significant amount of anxiety and depression. I think Theresa can also justify the amount of schizophrenia we see in the community, bipolar disorder we see in the community. Majority of that stuff stays at our normal statistical average associated with the APA. But the biggest part I think we see now more of is exacerbations of these diagnoses in the community. So that like you have bipolar disorder, you're staying on your meds, but you can't get in to physically see a therapist. You have to do it tele. Then that exacerbates anxiety or some way, shape, or form, or might make you have trouble getting in to get to your meds because of fear or closing at different hours. These things are the more that tie into what we're seeing more and more right now, especially isolation in the geriatric population. because they can't see family members. So it's normal diagnoses that are normally controlled and what we called used to be societal standards, which has now changed to more an isolatory lifestyle.
So how would you rank them? Like you mentioned anxiety, and out of all the different disorders, what would you name as the top three?
I would say this. Anxiety is probably our number one right now, but anxiety is not necessarily the middle diagnosis. People are finding ways to cope, but yet they're continuously having to adapt from that. And my thing would be like an anxiety, you can now go outside and walk and go do things, but hey, now it's starting to get cold again, so these adaptations that you utilize aren't there anymore because it's starting to get cold outside. And number two, obviously, would be depression, because that obviously with isolation. And I think number three would probably be exacerbation of a mood disorder, whether it be bipolar or schizophrenia.
So what do you think are some of the most common environmental triggers?
I think in a sense of trigger, I wouldn't say, obviously we're going to have our own frustrations associated with responses in society, like Governor DeWine's decisions or Ohio's decisions or your own community's decisions. But I think the biggest side is that you're usually your immediate environment's response.
Right.
Your family, your job. These are, you're not able to see your grandchildren. You're not able to see your kiddos can't go to school. Your response to adaptations to the quote unquote norm are what caused these problems and exacerbations of the mental health diagnosis.
So that's kind of the point of the program today, how COVID-19 relates to, an increase in mental illness. So I guess my next question to you is, do the causes really change? I mean, using COVID-19 as an example, clearly it seems like we're in uncharted territory.
Well, here's the side is, any exacerbation in your environment with relationships are going to affect your mental health.
Right.
So you made a great statement just now. You said, are the causes any different? No. The stress in life still causes depression, still causes anxiety. And here we are. It just so happens that we have a humongous stress in society. And it happens to be COVID-19. And it affects us all. One of my common responses I get from very mentally stable people without a diagnosis is, am I going crazy? And I'm like, what do you mean? And they're like, well, it's anxiety with the stress, with everything that's going on around me. And I'm like, no, that's a norm. Everybody else's children are at home. Everybody else is finding ways to work.
Exactly.
Usually one of the spouse or the other is not working now. You're having to find economic ways to survive or adapt. So, food changes. Obviously with the toilet paper changes.
Right.
These are simple things that can severely exacerbate your life.
Right.
I mean, God knows, being deployed, toilet paper is a blessing. And then to see it happen into our own country, our own mainland,
right.
That's a shock.
It definitely is a wake-up call, isn't it?
Exacerbate.
So this is a good place for me to put in a little bit about the caretaking of what.
That's a good point. So from your perspective at a department level, what do you see is going on, Theresa?
Well, one of the things that I like to draw a line between, and this is also related to Dr. Lazarus talking about what we're going through now as like a deployment. There are natural, normal emotional responses to stress and change and loss of your normal support systems. That's one of the biggest things going on in our community. We support each other on a regular basis without talking about it, without knowing about it, without thinking about it. Right. But suddenly, when so many of our networks have been broken, all of those invisible kind of assumed supports are not there. And then the isolation creates not a sense of, oh my, the world's falling apart, but it makes it look at ourselves and we think we're falling apart, which is what Dr. Lazaro was talking about.
I think it's one of the worst kept secrets in the world that at times mental health's a little underfunded, and given the huge increase of mental patients since the original or initial outbreak of COVID, we're kind of in some regards catching our tail a little bit.
I think the concept of self-care is a very important concept right now, and not just personally, but in groups and in relationships. As a nurse, one of my favorite I guess, sorting patterns for self-care is what we call Maslow's hierarchy of needs. And it starts with the basic things. You know, you have air, food, shelter, you're sleeping, you're eating. Then it goes up to things like personal security, having resources, financial resources, and health. Then it goes up to things like love and friendship. And if you have become isolated and are not eating, it is all the harder for you to call up a friend and start a conversation. That we have to think about ourselves and keep things in order because the society around us has changed the way we find that order.
So, Dr. Lazzara, the last question is for you before we go to mid-show break. So at what point does a mental disorder turn from a self-help type of situation to something you need to be admitted to the hospital for?
And that's a great question. And I always say, and it's, when does a mental health problem become pathology? And I say, and this is a kind of goofy one, but everybody seems to understand it very well, is anxiety. If you're so anxious or scared that you won't go to Walmart is one thing. If you just don't like the people in Walmart because they're weird or different or ununique to you is one side of pathology. But if you're running out of toilet paper and you're so anxious about being in crowds that you won't go to Walmart to get toilet paper, and you've already gone through the subway napkins and you finished all the paper towel and you're still not utilizing the toilet paper because your anxiety is so bad, now you got to step in and say, okay, we really need to probably have an admission here because you're unable to care for yourself because of such an exacerbation of simple anxiety, which is pushed to a pathologic level. And that's where you can't perform the duties of your normal life. The other additional that would be you're so depressed that it's gone down so much that you can't, justify living anymore. And you might not have a plan to harm yourself, but you just are in that such depression that you can't go on further. These are simple things that whenever you start to think become more and more complicated and more intricated so that you can't necessarily perform the duties of normal life, make it into work, take care of your children, take care of yourself. And that is when an inpatient admission is generally required.
I'd like to take this time to remind our listeners that all of TrueChat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations and information. To learn more about Mercy Moments, listen to the recap at the end of the program. And to find out where you can listen to us or engage with the program, please visit us at mercymoments.org. So welcome back. So just to recap, our conversation today has been about mental health, the COVID-19 outbreak, and the ability to handle and seek mental care. My guest today has been Dr. Jonathan Lazzara and Theresa Kahle. Welcome back.
Thank you.
So, Dr. Lazzara, the first question is for you. So kind of explain to everyone the genetic and environmental factors that contribute to mental illness.
First of all, I want to make a point that, everybody's got some genetic factors that tie in with these things. And everybody has a little bit of a lot of diagnosis, but that doesn't mean you have the diagnosis. Say, like, you can't pay attention, but yet you need some form to redirect or focus that works, that you can figure out some way to do it yourself. Doesn't mean you have ADHD. It just means you're having trouble focusing. Sometimes we can deal with stressful situations, or you don't like to be around people or certain family members, and you can develop exacerbation of anxiety, but yet you don't necessarily have anxiety disorder.
Right.
I think what the genetic component is that you have the genetic component. So if the environment sometimes will set up and surround you, then yes, you can have that exacerbation. But example of this is I have multiple bipolar patients who are stabilized on medication or are able to control their mental health diagnosis via therapy and minimal medications because they've found ways to adapt or work around it, or through it, I think would be a more appropriate term, versus a schizophrenic patient who has severe diagnosis or some way, shape, or form that once you have schizophrenia, you are going to require treatment, you are going to require medication. And these are little things that, you always have to have some stimuli in the environment to exacerbate this, because there are plenty of schizophrenic patients that find ways to survive with the voices or with hearing things in their lives. However, it's that inability. Remember, we talked about that admission criteria of adaptation with pathology, unable to work in society, unable to function, on those, as I love that Theresa brought up Maslow's hierarchy, in utilizing those things of how to survive yourself or interact with other people appropriately in society. And I'm not saying these are societal standards. I'm just saying that this is what we utilize for our criteria with the evidence and based medicine that we utilize for the diagnosis.
And I think that the public has a tendency to lump all mental illness in one basket or lump it in one bucket. So can you tell the listeners a little bit more about which conditions you consider a little more serious than others?
Here's the side. Every condition can be serious. Every condition can be exacerbated to a point that require medication, hospitalization, therapy. And my side is, WebMD is not going to give you your direct diagnosis and a solution to it. You just need to actually understand that. And you can have PTSD, but manage life. You can have schizophrenia and manage life. You can have depression and manage it. However, it's when we create those pathologic points, any diagnosis can actually cause severe issues in your life and require hospitalization. And this goes from anxiety, this goes to depression. Obviously, you're going to have thoughts to harm yourself. You're going to have anxiety so bad that you create bad habits to stabilize it. You can actually utilize, in schizophrenia, bizarre habits to reduce the voices that allow you to function in society. Again, we're tying back into that. So I don't want to say one diagnosis is more serious than another because, and even if you look through DSM-5, all diagnoses are put in there for a reason. They all severely affect people in some way, shape, or form, and they affect the lives and the families that surround them. And all Theresa and I, in our unit, which is their phenomenal team, work to do is create stabilization to push to an environment that they can function in, and then surround them with follow-on coverage to continue that stasis of stability.
So, Dr. Lazzara, in general, how has COVID-19 affected the number of patients that you're seeing in a clinical setting? I read a report recently where they believe that they've seen as much as a 20% increase in people seeking mental health since the outbreak. Well,
I will say this, and you can ask any internist or hospitalist this or ER doc this, we see a lot of mental health in psychiatry, but they are now seeing significant more. And you look at my mental health team and the amount of consults have increased in hospitalizations. And it's just simply, even if you're coming in, this can be a comorbidity exacerbating problem. So what do I mean by that? So if you have diabetes, right, and you're trying to eat a healthy lifestyle, and now you can only go to the restaurants of certain kinds, you can only get certain foods at certain times or places. Now you're adapting a diet associated with a diagnosis that can be exacerbated by a surrounding environment, which intentionally affected by the mood that you're in. Right. So again, all of these things are really getting played in. And I think the other thing that's happening too is the people around you are now being affected, and you're not getting that isolatory time to yourself to cope. Right. Like I said, I really worry about winter coming. How many people are bike riding and walking? And if you go into a bicycle shop or REI or online, you can't even find a bicycle anymore because they're all sold out, because everybody's finding adaptive ways to cope. Right. And that to me, that made me smile when I heard that with the bicycles. But the point being is that we're getting cold again. We're going to have to adapt again. And we're going to have to find ways to decrease our own stress in our lives. Right. And everybody needs to continue to work on this and share these ideas, and talk to each other, talk to family members, talk to your children, tell them why they're not going back to school, tell them why they're not with their friends. And it'll make you feel better and them feel better. So, Theresa, this question is for you. When you talk to patients, when you consult with them, are there certain factors that it seems more important to them than others? For like at the beginning of the show, we talked about having to homeschool your kids and things like that. Are there specific factors that people are noting that's contributing to their mental illness?
So again, at this point, would like to talk about society, and I would call it emotional upset that I want to discuss. Dr. Lazzara's got all the points in on disease and illness and those levels. But I think it's only fair to talk about where we are normal people in an abnormal situation and the factors that are going on right now that we can overcome, but we have to think about and sort them out.
Exactly.
So in the population that I serve as a nurse right now, they are elderly and they have been under quarantine from the rest of the world because they are the most vulnerable for months and months. And we have people who they just don't know how to feel about themselves because they have not seen anyone that they love. They haven't touched anyone that they love for so long. And
I don't think that people realize how important socialization is to mental health, that isolation is not a good thing.
So again, going back to the kind of spiritual background of, what is a whole person? What makes you be a positive and winning person instead of somebody who feels sunk in a society that is going downhill very fast? And one of my favorite concepts on that on a very big scale is the first few words of the Bible. In the beginning, God created the heavens and the earth. That concept of creativity, of making life, of doing something different for people that you love. The mail still works. You can write someone a letter and put a stamp on it and do something creative and different for someone that you can't reach and visit anymore.
Yeah, you're talking about it being love. And I tell people all the time that if you don't like people, healthcare is the wrong industry for you because you have to like people. You seriously do.
I also like to say that, of course, my job has to do with my staff also. And my staff, of course, is, they're caretaking for others. They have children at home. And one of the best things that you can do when you are in a crisis working situation, and this is where Dr. Lazzara talks a lot about, being on deployment. We all know that when you're on deployment, that team that you're on deployment with, those are the people who keep you going. And in every work area, social area, church spiritual area, the people who can create a team amongst themselves to help each other and encourage each other positively that they're going to get through it to the other end, those are the people who are going to come out and be able to survive it and also take care of those who are having a harder time. But the strength comes in the team and encouraging and knowing that you're there together getting through it.
So I think what we need to talk about next is resources. Like a lot of things in healthcare, we talk about, how to cure this or solve that, but we don't ever talk about how to actually get to the resources. So I guess my first question to you, Theresa, is what are some of the local resources that are available to the public?
The number one crisis resource for any mental health, emotional situation where you feel like you might harm yourself or harm someone else, or like Dr. Lazzara described, have a situation where you cannot function in your life because of a feature of harm, is the emergency room. They're all over the place, and you can go into an emergency room and ask for a psychiatric evaluation.
And see, I don't think that most of the public realizes that. They don't see that as a resource.
It is, and it's the most ubiquitous one. They're all there. You can call 911 and tell them, and they will take you there. And that is the number one emergency resource. Now, if you're not in that bad of trouble, you want to talk to somebody, there are crisis hotlines, there are your local county boards. But I just want people to know hospitals serve mental health emergencies. And if you have one, you can come to the emergency room and tell us you do, and we will serve you.
So, Theresa, how exactly do the various assets work together, in regards to like the fire department and the hospital and things like that?
So we do have a community network of outreach. There's an Adamus board. There are first responders. We have presented to the first responder team about patients with mental health illness. Interestingly enough, our local Adamus board did a study and discovered that while police and squads are called out to suicide issues, the number 2 thing that they're called out for is to attend to elderly with dementia who cannot cope because of their inability to think straight. And that is what our unit at Mercy Urbana is for. It is a senior behavioral unit for the needs of the elderly.
Which is kind of unique in a way, you know?
Yeah, it's a bit of a niche area. It also does cause a lot of ripple effect in families and communities when especially their revered elderly are beginning to show signs of weakness that nobody wants to think about. And it takes a certain level of true courage and love to be able to treat those very respected elders according to their needs, and still bear the respect that they deserve from having long lives and very productive lives.
I'm always amazed by the amount of resources here in Champaign County. Living in different counties over the years, things like the food bank and having geriatric psych. It's like I don't think most people realize how well we have it out here. I mean, it's just amazing. But can you tell the listeners a little more about how to actually get in contact with resources?
You have a crisis hotline here. It's 1-800-224-0422.
Also, I think there's a website that the county has that has a list of all the resources. It's, I believe, www.mhdas.org. I'll repeat again, www.mhdas.org.
There's a certain amount of stigma that exists when people actually contact a mental health professional. A lot of people don't feel comfortable. And, if you need help, I assure you that whatever you are feeling that other people will think you are crazy is not near as important as taking care of your own soul and your own needs. On the other hand, I certainly understand issues of privacy and feeling like, why should I be telling, this person who's earning money about all my personal issues? And for that purpose, often you can walk into a church and ask for a pastor. Mercy Health is a faith mission. It is grounded in the spiritual ministry of healing that Jesus Christ showed us. And we encourage people to reach out to ministers, male and female, leaders, elders, spiritual people, to get guidance, because that's normal. It's unusual in our society today, but it's actually the normal way that people have developed into whole and healthy souls.
Again, I'd like to thank my guests today, Dr. Joseph Lazara and Theresa Kahle. Thank you. You can listen to Mercy Moments on truechat via podcast on Spotify, Apple Podcast, and Stitcher, and anywhere fine podcasts are found. For Mercy Moments, Mercy Health Urbana Hospital, and truechat, I'm your host, Terry Allen Ceyler.
Theresa Kahle.
Dr. Lazara.
Thank you for listening today. Stay healthy, Ohio.